This PowerPoint presentation will discuss why I feel that it's important to help the elderly within my community. This PowerPoint presentation will supply the information that the elderly will need in order to obtain those services. Such services and programs as the Meals on Wheels, transportation, home health care, and some of the places where you can go for help to obtain these services, which is in the state of Texas where I live, would be the Harris County on Aging, Texas Department of Aging and Disability Services, and Elder Options of Texas. Now I'm going to start out, as I said, with Meals on Wheels. This is a type of program that the elderly people who live within my community, they love it because they're guaranteed a hot, nutritious meal every day. And it allows them to be able to stay within their own home environment without having to be put in like a nursing home or something like that. But they can stay in their own home with a little assistance with cooking and cleaning and so forth. But the Meals on Wheels program, like I said, provides nutritious meals to men and women who are disabled, elderly, homebound, frail, or at risk. It improves the quality of life, as I spoke, of allowing them to be able to stay at home. And it postpones them having to be institutionalized, like be put into a nursing home. So the Meals on Wheels program helps a lot because, like I said, my grandparents, they were on the Meals on Wheels program, and it helped us out tremendously because when we couldn't get over there at a specific time of day to get them their lunch, the Meals on Wheels program we were guaranteed, because the Meals on Wheels program was going to deliver them a hot, nutritious meal every day, and they really loved it. They looked forward to the people coming over there and supplying their lunch. The people were friendly, and as I say, there's no charge for this service, no charge for Meals on Wheels. As a matter of fact, the services that I'm going to explain, there's no charge for some of them. The ones that there may be a charge for, I'll give the detailed information as that for those as well. But the second one was transportation, whereas a lot of the elderly are not allowed to drive, or they don't have vehicles to drive themselves to the doctor's appointments or to the grocery store or shopping at the dentist. So they have a program in my area called transportation. What you have to do is call ahead of time, at least 2 or 3 days ahead of time, if not maybe a week ahead of time, so they can schedule and have you schedule, and someone will come out and pick you up and take you to your doctor's appointment, to the dentist, wherever you may need to go do your shopping. Someone will gladly come out and do this. I think this is a great service as well. And there's no charge to do so. There's no charge for this because the government is taking care of all this. And the next one that's near and dear to my heart also, because I have a lot of experience with these services because of my grandparents, is home health care. Home health care offers a variety of health care services which are performed in an individual's home for an illness or injury. Home health care is normally less expensive, more convenient, and just as effective as care an individual receives in a hospital or in a skilled nursing facility, like a nursing home. Doctor's orders are required. You can't just call up and say, I want home health care. Doctor's orders are required in order for the home health care agency individuals to come out, and before you start receiving care from the home health agency. When an individual's doctor refers him or her for home health services, the home health agency will then schedule an appointment to visit the person's home, to talk to them, to understand what they need and what they don't need, ask questions concerning their health issues, and they're going to relay that back to the patient's doctor, and that way they can come together and have a plan of care for that individual. That's why I like home health care. And as I said, it's less expensive than being in an actual nursing home or a hospital. So the next one is there's some responsibilities for a healthcare person. As I said, they have to make sure that the elderly are eating right, drinking enough water, taking their blood pressure, their temperature, their heart rate, and breathing. Also, they have to make sure that the medications are being taken along with other things that are prescribed for their health issues. Home health care, as I say, must coordinate with the patient's doctor in order to have everything together so the patient will be receiving proper care. Now, you may ask, where do I find these services? That's what I'm getting ready to tell you. You find these services in my area, which is in Texas. I said, state of Texas, the Harris County Area of Agency on Aging is a part of the nationwide network conducting supportive services for the elderly as mandated by the Older Americans Act of 1965. And it offers in-home services, caregiver training, and other supportive services. Now, there's another one. As I said, there was 3. The second one is the Texas Department of Aging and Disability Service, and they call this DADS, D-A-D-S. It provides a variety of home, community, and residential services to help people with physical, medical, or intellectual disabilities live their lives as independently as possible. It also offers services for their families who take care of them. And the next service is the Elder Options of Texas, which is an online directive of home care services, senior living options, and it could lead you to whatever you're looking for. You could just go to Elder Options of Texas. And in closing, I have discussed what programs are available for the elder who live in my community. The programs that I discussed were Meals on Wheels, transportation, and home health care for the elderly. And the other places where you can go and obtain these resources were the Harris County on Aging, the Texas Department of Aging and Disability Services, and Elder Options of Texas. It is important that the elderly population be aware of what resources are available for them, since many are not aware of such resources. As a result, the health may suffer for them not knowing what is out there for them. These services and our programs will allow many of the elderly to remain in their homes with just a little assistance. Thank you.